Hi, everyone. Welcome back to our podcast. My sister is a Karen. I'm Jennifer, and this is my sister Karen.
Hey everyone, welcome back or welcome. This is the conversations that we have when you hear someone say, I need to go call my sister right now.
That's right. That's what this is. And we want to start this week by shouting out Just Being Melanie on TikTok. We have seen you. That's right. We have seen you, Melanie. We have heard you, and we want to sound off on our own We Do Not Care situation. If you have not seen this, Just Being Melanie started a thing called the UDNC Club. We Do Not Care Club. It is for perimenopause and menopausal women. And we just talk about all the stuff that we do not care about anymore. So, this is our official application for membership to the club. Melanie, Karen, do you want to start?
Yes, we do not care that I have multiple pairs of glasses on my head. I'm going to lose them all in the next half hour. So get over it.
We do not care if my direct response sounds short and it hurt your feelings. Get over it. I said what I said.
Yeah. We do not care that you think my makeup is too loud or that I look like a drag queen. I did it on purpose.
We do not care about dating men our own age. At this point, dating is all about the view, and it's not that great when they're my age.
Yeah. We do not care that my hair looks like it hasn't been brushed. It hasn't.
We do not care about going to bed after working out without showering. This is the best part of being single. And quite frankly, I'll either go to the gym again in the morning or I'll take a shower, one way or the other.
Yeah. We also do not care about period blood on our sheets. It happens. Um,
Sure does. For like more than 20 years now. We do not care if we hit a curb in the drive through at Starbucks. We also do not care if the mirror on the car hits that weird shelf that sticks out too far from the building. Starbucks needs to redesign that stuff anyway.
Right. We do not care about panty lines. I'm never, ever again going to wear a thong. So you will see that I wear granny panties. They're very comfortable. You should look into it.
I literally have the same one. I go, we do not care what our panties look like. We only care what they feel like. We also do not care about panty lines and our work clothes. Be glad I bothered to wear them.
For real.
That's a two.
This one. We do not care that I have not washed my cup in a long time.
Okay,
Change the straw out. Okay.
we do not care that all the women who came before us suffered through menopause and perimenopause in silence. We will not. The women who come after us will be thankful.
Like, say it louder for the folks in the back. Is how I feel. I think we should end on that one because that pretty much sums it up.
Fair. Yeah, I think um this this conversation that Just Being Melanie started a few days ago. And let me just say, if you look up WDNC on TikTok or We Do Not Care Club on TikTok, there are thousands of other women who are chiming in. This is not only Just Being Melanie, women of all backgrounds, women mildly ranging in age. I mean, obviously, there's an age that's tuned into this,
Right.
but and all walks of life, and they're describing the things they don't care about. And this is such a good opener for us because when we started talking about doing a podcast, like when it was just barely an idea, we talked about wanting to like join the conversation about menopause and awareness and our own experiences and just like how confusing it is that we don't even know what it is. I didn't know the word perimenopause. I literally learned that word like 2 years ago. Well, I was already in the throes of it. Like, it
Yeah.
just, it's just so
I don't
weird.
think that was a thing. Like, we didn't learn about that in nursing school.
No, but for whatever reason, I'm sure part of it is that we're in the cohort with the heightened awareness. So that is part of the reason that we are, a little more hyper aware and it pops up on our TikTok and stuff like that. But it is also just a whole thing that no one really ever talked about. No one really researched it. Come to find out, the reason no one was talking about it was because nobody was researching it. And while Karen and I don't think we're smarter than other people when it comes to this, we are not. Like we don't know anything about it. We know what we've learned from like Mary Claire Haver and Just Being Melanie and people like this. Like
Yeah.
we don't know. But we did want to be a part of moving the conversation into a more normal place. And so it's just really timely for us that this whole movement is happening on TikTok a few months or a few weeks into our podcast journey because it aligns with what we wanted to do.
Yeah, I mean, one of the things we even discussed as like a name for the podcast was like, nobody told us about this. I
Yes.
mean, we really feel like, I mean, I live with my mom and dad. We're close with our mom. We have a bunch of aunts. Both of our grandmothers were alive until Jennifer and I were in our fees. And we still felt very ill prepared because nobody talked about it. So also I mean, like I had no idea so many symptoms were from menopause.
Well, and it's just like we talked about a few weeks ago when we talked about language. And we said, like, when those words don't exist in your language, then that means that the concept isn't discussed because there wasn't a reason to give it a word then. Like perimenopause, I mean, we just said we didn't, either one of us know what that word was. And so that means it hadn't been discussed.
Right.
Um, yeah. And I know like you had a thing a few years ago where you went in and got some blood work run. I don't know it's the end of
Yeah.
the day, guys. I worked all day. We don't normally record after a work day. And I think my mouth is not working right now.
Jennifer doesn't typically have the perimenopause brain fog. I do, but we'll just,
Really struggling
we
today.
do not care about the struggle.
We do not care if we look like idiots while we're recording our podcast.
No, not even a little bit. Yeah, like a year and a half ago, um, I went to my doctor and I was like, I think something is wrong. Honestly, so I might have mentioned, I'm a cancer nurse. I don't know if I've said that before. No. So I, of course, thought it was like leukemia or something. Um, But I went in and I was like, I don't feel good. I'm exhausted like I worked at a clinic at the time. So my job was not like 12 hours lifting patients and stuff like that. But there were times when I would get home and it was a struggle to just stay awake until like 8:30 p.m. I felt terrible. I would get night sweats, not hot flashes because those are literal flashes. I'm just fucking hot all the time. I mean, I actually, what I thought was possibly I had like an autoimmune something going on because I was just like, it's very vague, non-specific symptoms, but like something's not right. Like my joints hurt. I keep sleeping on my arm wrong and then my shoulder is weird. No, it's frozen shoulder.
Uh-huh.
So my primary care person, who I actually love, I did feel like she listened, she heard, and she was like, okay, let's do a bunch of labs. So one of the things I specifically asked, can you check my hormone levels and see is this menopausal? So she did, and my hormone levels were appropriate for where I was in my cycle. Um, Now I found out, just getting a snapshot of your estrogen, progesterone, FSA, all that stuff, that's not going to tell you anything because it's not cycling like it's supposed to. It's just in chaos. So I happened to go in like 2 days before I started my period. So my hormones looked like that. Like they looked
Yeah.
like I was right before I started my period. But if I had got, like what you need to do is you need to have them track it and see, is it following how it's supposed to? So you need to go in like once a week. And to be honest, no insurance is going to pay for that
No.
because there's
No.
not a treatment that they're going to give you that is, that they're going to make money on. So I really, and I still feel like, is this all perimenopause or, I mean, and I am a hypochondriac. It's just, I mean, it's just like, am I supposed to feel, and I really, and I am overweight.
Uh-huh.
So I also, I mean, I start the conversation with, look, I know I need to lose weight. That's one of my complaints is I've been on a diet since puberty. I know how to like, lose weight and how to eat right and whatever. And the things that I used to do to be able to get back into my jeans are, it's not just that I'm not losing weight, I'm continuing to gain. And it's all around the middle, that visceral fat that's so bad for us. So they did, I mean, she did check and she checked like all my blood counts, checked even like inflammation marker, checked my thyroid. Because a lot of people, apparently a lot of women, when they go in and they're like, oh, check my hormones, the hormones they check are your thyroid hormones.
Correct.
And your thyroid can make, like, if your thyroid's jacked up, you will feel crummy and tired and, but then what's happening is like, oh, all your labs look great. And then that's kind of the end of the conversation.
Uh-huh.
Like, there's no further, yeah, I'm like, okay, well, my labs look good, but I still feel like pee pee caca poo poo.
Yeah, I had a similar thing. It was like 2 or 3 years ago, and I went in to my primary care physician, same as you. I wasn't thinking puberty. I wasn't thinking menopause. I wasn't thinking that. I was there for a couple of things like I don't go to the doctor very often. And so I sort of like had a laundry list of things that I had been like, I don't like, I'm gonna get there eventually for this knee thing. I'm gonna get there eventually for this other thing. I'm going to get there. And I don't know what it was that I don't remember what it was that drove me in that day. But while I was there, I too was complaining about weight gain. I was like, my weight fluctuates a little bit in general. I don't really get overweight, but I was like, my weight does fluctuate a little bit. And this time, what I do normally isn't working. What I do normally is I go to the gym every day for 2 or 3 weeks. It boosts my metabolism. And then within a few weeks, I'm back to where I should be or wanted to be. And so I was like, it's not working this time, which is really weird for me. I also tend to kind of lose weight faster than like women lose weight slower than men usually.
Yes.
To say in general, I don't want to say I follow a male pattern on that, but I do lose weight pretty quickly. Like when I get overweight, it's pretty easy. When I put on a few pounds, it's pretty easy to get them back off. I was like, it's not coming off. It's just really weird. Like this has never happened to me before. I know exactly what to do. It's not working. And she was like, let's get you to a dietitian. And I go, okay. And then I also was like, I think I have also torn my meniscus in my knee, which I had done in the past when I was young. I had done it in the same knee. And I was like, and I feel like the meniscus is bothered because I'm carrying an extra like 10 pounds or whatever it was. And she was like, well, that's possible. Let's get you to some PT and let's get you to ortho to look at that. I mentioned I had this like pain. I don't know if it's frozen shoulder, but now I feel like it probably was. It was like a weird pain, like just like Karen said, it felt like I had slept wrong. And then the other thing was, and I remember vividly telling her, I go, because she was like, is there anything else? Are you depressed? And I was like, I don't think I'm really depressed. But I'm not like loving, like my life
Yeah.
right now. And I remembered saying to her, for over a year, I have been waking up at like between 4 and 5 in the morning, and I'm just awake. Like, that's it. I'm awake. And I was like, it's really weird because I don't necessarily feel tired still, but I have never been a morning person. Like, that's never been for me. And so I read my laundry list. She took action on all the things, including offered, maybe I shouldn't say this, but including offered to talk to me about like an Ozempic. Because I said to her, I know you look at me and you're like, you're not overweight, but this is not the body that I am used to. And I'm very uncomfortable. And I had said to her, like, I won't go meet friends for dinner or drinks. I won't go out on dates. Like, this is so uncomfortable for me that it's preventing me from everything. And so
Yeah.
he even said, like, I want you to see a dietitian. I want you to get the knee straightened out. I want, like do these other things. And if they don't work out and the weight is still on, come back and we'll have a conversation about Ozempic. I don't know if we can make it work for you, but we can talk through it. The whole thing at the time, I felt so heard because she listened to all my complaints, even talking to me about a mild opportunity for Ozempic. I didn't go back and do it, but even to talk to me about that, like she literally listened to everything I said. The problem was she, just like me, she had no idea that all those dots needed to be connected because they probably did. And I think, I saw again, like we always talk about Mary Claire Haver, who wrote a book called The Pause and has a website called The Pause. She talks about it can't fall on just the OBGYNs to understand menopause. The problem is a lot of us aren't even getting to the OBGYN. The problems I was
Right.
having do not feel like gynecological problems. I went to the gynecologist 4 years ago when I was having problems with my period, and come to find out I had fibroid tumors in my uterus. They didn't say anything. I mean, they looked at my age on the thing. They didn't say anything to me about, like, are you having any other symptoms of menopause? I even said to him, like, I don't know if my periods are weird because I'm having menopause. Like, I don't know. He didn't correct me and say perimenopause because that would have been the moment I was in. I mean, there was no discussion about it at all. He was like, let's do an ultrasound and see if you have any fibroid tumors. Yep, you do. You need surgery. And that was the extent of the entire conversation, which I didn't even do the surgery. And then I didn't go back to the OBGYN. OBGYN. See, there goes, I'm tired tonight. I'm real tired. So I don't know. I think it's got to spread like wildfire because we as women in our fees, we aren't going to the OBGYN saying I have joint pain and I'm overly tired and I have night sweats. That's not where we're going. We're going to our PCPs and the orthopedists. I went to the chiropractor for 6 months for this shoulder thing. Again, no, I saw four different chiropractors at the same practice. Not one of them said to me, like, you're in the age and there's this thing called frozen shoulder. Like, they need to know too.
Yes. Well, and I mean, that's how I feel is, I mean, I'm not in any area of that, but I do also like as a nurse, shouldn't I have some additional info on this? I don't.
No,
No.
no.
And we go to our primary care, but our primary cares also are essentially like they're like putting the band-aid and they're going to send you to a specialist.
Right. They're gatekeepers, is what I always tell. Yeah.
Yes.
And we are two medically licensed and educated individuals. And yet my primary source for information about menopause and perimenopause is coming from TikTok.
Yeah.
It pains me to say that. Like it literally hurts me deep down in my soul to say that. But that's where the information I'm getting is coming from. I mean, I did buy like the book that Mary Claire Haver wrote. I haven't read it yet. It hasn't arrived. But like it's not that I'm not trying, but the information is not readily available to us as professionals or just as like lay people going through it.
Right. Because notice both of us said we felt heard and
Mhm.
we felt like I did not feel like my provider was like, well, Karen, if you lose the weight, she was like, you're right. If you lose weight, that will help with some of it. But like night sweats has nothing to do with being fat.
Oh, and I didn't mention, but when I did see that doctor, she ran blood work for my thyroid, like you said. She didn't run any other hormonal panel, just the thyroid. And the other really weird thing that happened, which now I have a better understanding of, my cholesterol was very high. And I was like, when she called me back, or when I went back for my follow up or whatever, and she was like, look, your cholesterol is like really high. Like, you have got to get into the dietitian. You've got to work out. You need to. And I was like, I don't have high cholesterol. And it was so high. And I normally have like my good cholesterol is really high, my bad cholesterol is really low. It's been like that my whole life. My blood pressure is always really low. Like I've been blessed in that way genetically. And it was so alarmingly high that I was like, you need to rerun it. Like, there's no way. There's absolutely no way my entire life, my cholesterol never looks like that. We reran. She was like, well, were you fasting? I was fasting. I did what you said to do. So we reran it like a month later. It was still really high. Well, again, according to Dr. TikTok, turns out your estrogen is a natural way of lowering your cholesterol. And when your estrogen is really low, your cholesterol often goes up.
Right. Which then cannot be corrected or treated with diet and exercise.
No,
Like, because
take
that's,
protein,
I mean,
man.
like the first time that you have a high cholesterol, they don't always slap a pill on you. I mean, someone like you, they'd be like, okay, you work out, you do stuff like I mean, you've been eating healthy for a lot decades.
I mean, don't act like I can't kill a bag of jalapeno Cheetos or something, but you're right. In general, I have a pretty healthy diet, high protein, low carbs. I don't know about low carbs, high protein, high vegetables. I eat more chicken and salmon than anything else. Like, yeah, there's no, other than genetics or an estrogen shortage, there's no reason for my cholesterol to be the way it was. I was mortified. I was literally like, this can't be. Like, this literally cannot be. It was crazy. And like I said, then, you learn from TikTok, like,
Yeah.
oh, there you go. It's really weird. And I mean, there's also a lot of discussion about the level of mental illness that is diagnosed and treated in women during perimenopause and menopause, which is actually astonishing if you see some of the stats about it.
Yeah. Like I just told you, I saw a thing, the number one age group of women that commit suicide is like 45 to 60. It's right in that perimenopausal age. That's when, a lot of women get put on psych drugs like an antidepressant, an anti-anxiety, maybe something that has a little bit of both or whatever. And it's not that those don't help. Those things do help. And if, but it doesn't solve the issue. Like that's just a
And you have to wonder if I mean, by the time that you're 45, you've lived a lot of life. And by the time you're 60, you've lived even more life. And most of us have a level of self awareness by the time we get to that age, not to mention, like, just in general, you don't get to be 45 to 60 without having an awareness of your body, understanding. And if you're somebody who's never been depressed before, and now you are at 45, 50, 55, 60, to the level that you need antidepressants or even like suicidal, like that should be alarming.
well, and I think some people who like I recognize the stuff that comes before when I'm gonna have a major depressive episode or what, um, because I've been dealing with it forever. But
Yeah.
if at 45, all of a sudden you have depressive episodes or whatever, some people don't even recognize and we blow it off. I'm just hormonal. I don't know. I couldn't stop crying for like 2 days. And I mean, I have a friend who was like, I know, I'm so hormonal. And then she, like a year later, was like, no, actually, I was depressed because I've been doing really good on Zoloft.
And it's crazy too because like you could be hormonal, and if you balanced your hormones, would that solve the depression, or did you really need Zoloft? It's weird to think about. I mean, it's weird to think about like which treatment would be better in this
Right.
situation. I mean, if you're somebody who's not been able to get out of bed for days and you haven't been going to work and you haven't washed your hair or brushed your teeth, or, like you are that level of depressed, well, you do need to be on a Zoloft or something like that. Like that's probably true. But also, is the root cause still a hormonal issue? Because if that's the root cause, then you're still not actually treating the problem. You're treating the symptom of the problem.
Well, and I mean, like I can tell you, um, there was like one study a long time ago that said if you do hormone replacement therapy, that increases your risk for breast cancer and hormone driven cancers. Well, that study's been debunked multiple times,
Yeah.
but even healthcare providers
Mhm.
aren't, nobody comes out and is like, oh, you know what? You should actually be putting women on HRT because not only does it not increase their risk for cancer, it decreases their risk for a lot of stuff, including cardiovascular disease.
Yeah. Well, I mean, again, Mary Claire Haver, our personal hero, is actually
I
coming
love
out
her
and
so
saying
much.
that. Yeah.
Yes.
I do. Oh, go ahead.
No, I was just, she is, but she's in such the minority. Like that's, I mean, I just saw a TikTok of a woman who was like, she was at her OB/GYN for her regular check, whatever, and was like, am having all these symptoms. I'm fatigued. I have joint pain, brain fog, da 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 da. Can I get on HRT? And instead of dealing with the problems, her doctor chose to give her a 3-minute lecture on why HRT is dangerous. And then she was like, her TikTok was like, why is this still happening? Like,
Yeah. Yeah. It's not good. And it's doing all of us a disservice. And I think like the whole thing of like every single woman who is alive and lives to be this age will go through perimenopause and menopause. It is the only thing that every single one of us will go through. Unless like you, I mean, there's a few exceptions and those are surgical, health,
yeah.
but the rest of us all will go through it. Yet it's just swept under the rug in so many cases. I feel like I've been pretty lucky as far as my symptoms go. I mean, I did complain about the weight loss that I had or the weight gain that I had a few years ago. Still, my mouth is not working. I complained about the weight gain from a few years ago. The thing, I don't, maybe I did tear my meniscus, maybe I didn't, I don't know. But once I got back into the gym on a regular basis, stayed there, also kept my weight at a pretty level. I mean, it fluctuates down, but it hasn't fluctuated up for a couple of years now. So then the knee doesn't really bother me. Occasionally it does, but not very often. But I do feel like I haven't had hot flashes. Maybe I've had like one or two or three here and there, but in general, I haven't had hot flashes. I don't think I've had a lot of brain fog. I do have the sleeplessness. It's better now than it was, a couple of years ago when I was waking up at like 4 a.m. I do notice now I'm a lighter sleeper than I was when I was younger. My dog is running out of the room. Um,
But you also are taking supplements that should help with the sleep. Like
yes,
you're taking magnesium and you've
yes,
noticed that that helped, right?
yes, but it still is, yes, it's helped, but not enough. But what I would say is I would guess, looking back, that there were a couple of external events that might have masked some of my menopausal moments. For example, COVID. I probably didn't handle COVID very well. And I was at the time I was in a relationship. The relationship like essentially fell apart during that window of time. But there was a like, and there were a lot of things happening. Like we were both healthcare providers. So we were working during the time that everything was locked down. My daughter had to move home from college. It was her second year of college. My son, had to do virtual, like all the things that everybody else had to deal with, same things that everyone else had to deal with. I didn't handle it well. Like I would definitely say looking back, I did not handle that well at all. And I was probably pretty difficult, especially in that relationship. I was pretty difficult with that man. And so I wonder, like, was some of my inability to manage some of that? Like I struggled to stay like I'm pretty level emotionally. Whoops. Emotionally, I'm pretty level a lot of the time. And if you don't know me, I don't even like sometimes people will be like, are you even excited? And I'm like, oh my God, I'm super excited. But I'm not extremely expressive. And I wasn't able to maintain my sort of even Steven way that I tend to live my life during COVID. And then after COVID, like as the world got better or worse, whatever you want to call it, but the world opened back up again and people started returning to some of their normal activities, then that relationship had some issues. It was pretty damaged. So I wonder, looking back, like, was some of my inability to manage my emotional stability, was that the external source of COVID and then later the external source of my relationship coming apart? Or was that a perimenopause impact and COVID compounded it? It's really hard to say, but I will say, like, I know I will talk to people and I'll say things like, I don't know, I just don't sleep like I used to. Oh, you're getting old. And I'm like, I don't disagree. I am getting old. I have more life behind me than I do ahead of me. God, I hope so. And that's the plan. But I don't know that all of this is just straight up getting old. Like some of it is like I've gotten old and now my hormones are wonky. And so I just, it's interesting how everybody just throws the year. I mean, our mom, I don't know how many times in that 2 year window or 2.5 years where I really did not sleep for like 2.5 years. Our mom told me so many times, like, oh, you're getting old. Welcome to the old ladies club. Like she kept saying that to me. And I
Yeah.
don't disagree. But I was also like, she never said to me, like, do you think this is anything to do with menopause? Like your relationship is in turmoil. I had moved during this window of time. I moved across like many far away from where I had lived.
Yeah.
Like nothing about any of that. And then also nothing about menopause. And I'm like, well, she went through it.
Yeah. I and I think like and that kind of perfectly illustrates like you have not dealt with depression.
No.
So when you have that, like, yeah, it's a new thing, but like, you're not necessarily tuned into all of that.
I was not at all. And I would say, looking back, I kind of came to this realization a few years ago, looking back on the time during COVID when everything was locked down and I was like fighting with my kids. I was fighting with my fiance at the time. I was unpleasant, probably at work. I don't, maybe.
Mm.
I don't care anymore. I don't work there, but I mean, in hindsight, I do care. But I wonder looking back, I feel like some of like, remember in puberty when you had just like that teenage angst and it just felt like everybody was against you? And that's what I felt like. So in hindsight, I'm like, ooh, that probably was a little touch of some perimenopause, but it was so misplaced because I was so able to blame it on like we're in a global pandemic. None of us ever done this before. And so I was so able to place all of it on that. And I think, in fact, it was a lot of perimenopause hormonal shifting, but there was this external thing and it clouded, it just gave a different excuse for everything.
Like to say, as awful as you think you were during COVID, you did take my son for like 3 or 4 months so that he could I mean, he went and stayed so that because our boys are almost exactly 2 years apart and, they are besties and we love that. So as awful as Jennifer thinks that she was, she also had an extra kid, an extra mouth to feed.
I
And
don't think
Michael
it was.
never one time was like, pretty Aunt Jennifer's cranky.
No, he was very pleasant while he was there. I don't think it was 3 to 4 months. I think he was there for like 6 to 8 weeks.
Yeah,
But
I think it was probably about
he
2.
was like in seventh grade. He literally fucking hated virtual school, like hated everything about it. And he was a champ. He came and he stayed there and he was affectionate with me the way he always is. He was,
Yeah.
yeah. I didn't have any fights with.
Yeah, I mean, I think it just I mean, and like we kind of touched on, like nobody's done research.
Uh-uh.
They just in the last like 3 years, there has now been a pill that is specifically made for hot flashes. They
Right,
just did that.
right.
I mean, like
Yeah,
one of the
that's the
other statistics was like every woman goes through perimenopause and menopause. Not all of them have hot flashes or whatever, but every woman goes through that. And we just now came out with a drug to treat one symptom. It's like
might be the
less than
most
10% of men that have erectile dysfunction, and we have like 6 different drugs for that.
is maybe the most well-known symptom of menopause. In my mind, that's what I have been waiting for. Like I'm still like, when do the hot flashes come? Like I'm waiting for the hot flashes and I'm a cold person. Like I'm always cold. I would keep during the summer in Arizona, I would keep the air conditioner at 78 if I could. My kids literally would come unglued. But like I am a cold person. I literally am like, where like when do the hot flashes come? It's the most well-known symptom of menopause, I think. I don't know, maybe today it's different. Maybe today, like we talked a lot about brain fog and people talk about the joint inflammation and the other things. But I mean, 5 or 6 years ago, the only thing I knew about was hot flashes.
No, 5 or 6 years ago, I was like, I'm tired of having periods. Bring on the hot flashes and let me just skip all this crap every month. I mean, because I was like, whatever. I mean, and I knew that they weren't like a cakewalk, but I also was like, whatever.
Yeah.
rather have hot flashes than a period. But now I'm like, I mean, I guess I'd still trade for hot flashes, but can I get rid of some of the other? Like my back is killing me right now. I have no idea why. I did not do anything special
Yeah.
today. And I'm like,
Yeah.
because estrogen is a natural anti inflammatory. So when it plummets, then things that we don't even realize our body is fighting with.
Yeah. It's been a journey. And I mean, we come from, you said it earlier, like we have like 9 or 10 aunts. Our mom is in our mom's family, there were 7 girls. Both of our uncles got married to, so we have aunts that way. My dad had, we have an aunt on my dad's side of the family, our grandmas. And it was like literally, I know nothing. And we have close relationships with a lot of these aunts. I know
Yes.
nothing about any of their menopausal journeys. Nothing, nothing. And it's crazy. Like once a year, I get together with mom and 2 of the aunts. We would call them, I call them the primary aunts. There's like,
Yeah.
the 2 that are closest in age to our mom. I get together with them for like 4 or 5 days. We stay in the same house. We needlepoint and knit all week. And no one has ever said to me, like, Jennifer, let me tell you about my menopause journey. Or like, I mean, just not even a peep about it. Like, literally, not a peep.
Well, and it's like I say to people when because like, or do you have any pain? So, and a lot of people, men and women, over like 40. Well, yeah, and I'm like, okay, some of that is normal wear and tear. Your joints are going to ache and whatever from, using them for 40 years. But in general, pain is not part of the aging process. Like
Right.
when people are like, oh, just the normal getting old pain. And I'm like, what do you think is the normal getting old pain?
But I'm even just talking about like I have no idea what symptoms Aunt Kathy, Aunt Mary, I have no idea what symptoms any of them are. Mom, none. I don't know. Yet, you and I both had babies. Our mom had babies. I do know a fair amount about mom's childbirth journeys. We've compared,
Yes.
and it was interesting because my delivery stories for my kids are not terribly different from some of mom's. Like we did some very similar things during labor and delivery. And so if that's true, maybe we would do some very similar things during menopause as well. It seemed like a logical leap to make. I
Yeah.
don't know. Maybe there's research that says that that's actually not true at all. I wouldn't know. But
They
I
haven't
just,
done it yet.
now I feel like it would have been really helpful. I mean, we have an aunt who's less than 10 years older than us. Like I don't even know what I mean, granted we're not close with her today. We have been in the past, but it's not like I don't know her. It's not like I don't like her. Just I don't know what it's like for her. It's weird how these journeys are literally not discussed at all and information is passed down from mother to daughter.
Yeah.
I
Because
mean,
even, I mean, I like, I understand men think it's like cooties or whatever. And so men don't, but I feel like I mean, like you said, you spend 4 or 5 days with them. And it's not even something like maybe Aunt Kathy, I would be comfortable enough to be like, what symptoms did you have in menopause? But it's not something that we think about. And like for sure, I would not have asked either of my grandma. I mean, I remember when I was pregnant and living with grandma and gramps, like I would, I had the like what to expect or book or whatever. And I remember grandma being like, you guys know too much about what's going on in your bodies. So, like, for sure, grandma wasn't going to tell me that stuff. But, like, can we break that cycle? Can we make it where
right.
you can talk about it?
We have the cycle has to get broken. Do you
I
remember
know.
when we were younger? I mean, we were like late. like late teens, early adults. And dad played on a basketball league at church,
Yes.
and like the over 50 basketball league or the over 40 basketball league or something. And our dad was the youngest man on the basketball league. And I can remember him saying, like, mom telling me one time that she had made a comment to dad about like menopause, blah, blah, blah. And dad was like, "Oh, don't say that to me. All the men at basketball literally are like, it's the worst thing that's ever happened to them is menopause." So they were talking about it, but the conversation needs to shift from like, ugh, don't say anything to me about that because all the men, like, it needs to shift from that. I do have to get on a soapbox for a second and brag about my son. So my son,
Yes.
um, I do raise my children very openly. And I work really hard to try not to give them gender stereotypes. Like I try not to like make my son do the yard work and my daughter do the housework. I tried to like avoid things like that. It's not always easy because sometimes you don't even see them in yourself. Sam, was raised in the house, Lucille and I, and then, like Karen's around occasionally with Michael. My other sister's around. I do have a brother, but um, we were on family vacation one year. This was a year that you didn't go because this was a house in the mountains and like there were bears there. And my mom and Lucy and I, or no, sorry, mom and Sam and I are out running errands, or I don't know, maybe we were going to get coffee together or something. And I get a text from Lucille. We're driving back home and she's like, "When are you going to be home?" I go, "Oh, we're on our way." And she was like, "Can you stop at the grocery store at the bottom of the mountain and get me some tampons?" I go, "Sure." So I pull into the grocery store parking lot and our mom is like, what are we doing here? What did you need?" And I go, "Oh, Lucille said she started her period. I'm going to run in and get some tampons." And I was like, "You guys can just stay in the car." And Sam is probably like 14 at this time ish. Sam is like, "Do you want me to go in and get them?" So proud of him. I go, "Do you know what to get?" And he goes, "Well, the ones under the sink in the bathroom." I go, "Yeah, yeah." He's like, "It's like a blue box or whatever." And I go, "Yeah." I was like, "Take your phone. Oh, here's my debit card. Call me if you need help or whatever." He comes
Yeah.
out. He did not even make them put them in a bag. He comes out carrying the box through the parking lot, gets in the car, and he's like, "Is this the right one?" I go, "That's the right one." Felt so successful as a parent, like so
Yeah.
successful. And also not just as a parent, but also like I felt like just like bam, I broke a barrier. Like my son did it. Like our dad would never. We would have called Aunt Kathy, who lived 30 minutes away from us. We would have called Aunt Kathy to buy us pads or tampons before we would have asked our dad, who lived in the same house. Like our dad would never.
Yeah.
I don't think our brother would either.
No,
He
I
might
don't think so.
surprise me. He might surprise me. I don't know. But yeah, that was probably, like I said, that was like a super proud moment for me as a parent. I just really felt like my son just saw this as something that happens. Like this was not, it was literally the same as having to go buy a box of tissues for his sister.
Yeah.
Like it was no big deal. And I love that about him.
Yes. I know. Sam, both of your kids are very, I don't want to say like feminist, but because they're very like social justice, all equality,
Yeah. You
Yeah.
can say that they're feminists. I probably raised them to be feminists.
So I do want to hear about your mascara real quick before we cut this off.
Yeah. So, okay. So I put it on like six here. I put it on like 11 hours ago, and I think it looks pretty damn good. So this is another
Good.
drugstore one. It's Call Me Queen by Essence. And I think it says like dramatic, yeah, dramatic false lash effect is what it says. So it is designed to be like really lengthening. I really like this one. I think it's like 11.99. Also, it has a silicone brush, which I don't always know if I like, but the bristles are a little bigger on this silicone brush. It gives great length. It is just the right amount of wet for me because I don't like a really wet formula.
Yeah.
I actually like, I super love this. Essence is a really viral mascara. Like they have like 4 or 5 formulas and people love them online. This is probably the third or fourth thing. Well, I think they only have like four. So it's probably the second or third one that I've tried by them. I've never been disappointed, but this is worthy of an everyday mascara for me. I love it.
Yeah. The lipstick lesbians endorse that one as well.
Oh, do they? That might be why I tried it then. I might have seen that. Oh, you sent it to me.
Yeah, because you were like, that's what I'm testing this week.
Funny. Yeah. Yeah. So
Yeah, which is
I do
that's
love this.
part of our menopause, perimenopause journey is the eyelash disasters that we are. Like, I mean,
There's
again, no one talked about that and said, I mean, like my skin is totally different, you
I was
know?
just gonna say there's a lot of stuff like products that I've had to vastly change. I've never used lotion every day on my body, on my face, absolutely, but on my body. And I even like the guy that I referred to that I was engaged to during COVID. He would even be like, I've never seen a girl that like kind of hates body lotion the way you do. Cause I just like it felt too slippery. I don't like it. I use body lotion every day now. There's a lot. My makeup doesn't apply the same. There's just a lot.
Yeah.
Like there's a lot that has changed. And I've just like figuring it out a little bit at a time. And one day something works and the next day it doesn't. Or
Yeah.
yeah.
So tell us what you had no idea was related to menopause. Please tell us if you talked about menopause with your moms or aunts or neighbors or whoever. And please go out and discuss it. Make it okay.
Yeah. We do feel passionate about like moving the conversation forward. So, I mean, chime in and let us know what you think. Also, getting back to just being Melanie, chime in and tell us what you do not care about today, or ever again. We don't care.
Yeah. And tune in next week. All right. I think that's it. I wanted to say something because I don't think we've ever explained this. So when Jen and I get off the phone, because we're like, this is the conversation. Now we just have it in front of a computer or whatever.
Yeah.
When we get off the phone, we legit, I'm like, okay, love you, bye. I have had people like now, and the I love you thing, we just started doing that like a couple years ago, where we say that every time. But we used to just, and I've had so many people that will hear me on the phone with you, and I'm like, oh, okay, bye. And they're like, who was that? Oh, that was my sister. Are you mad at her? No, not at all. So when we sign off and we're just like, love you, bye, that's legit how we sign off because it's like a temporary, we're going to be back talking shortly.
We hang up on this and we call again later tonight.
I know, exactly.
We're Midwesterners, but we do talk fast and walk fast. Like I don't know if that's unique to Kansas City or if that's unique to our family, but yeah, it has been mistaken for a disgruntled or a
Yes.
irritated. I love you, but that's not it at all. It's literally just like we're just getting off the
Yeah.
phone.
Yeah, exactly. So tune in next week and please tell us your We Do Not Care Club and your menopause stuff. We want to hear all of it. Thanks, guys.
Okay, love you, Karen.
Love you too. Bye.